everybody. And this is Mayor Mark from Fort Lee. So excited to be part of this program tonight. And first, I want to thank the Fort Lee Library, who just time after time has these timely and great programs for all of us to enjoy. We have a really incredible guest tonight, and we're going to get to Mr. Dotter in a moment. It was a few days ago on March 4 that Fort Lee held a 1 year anniversary acknowledgement, call it, for having the first COVID case in the state of New Jersey on March 4 of 2020. It's been a year since that first case hit Fort Lee. And from the moment that case hit our community and everywhere else in the world, it was all about essential workers. It was all about these emergency service folks, these volunteers, folks I never even knew their name in town, and now they're just our heroes. And it's unbelievable how they have risen to the occasion. And it's in fact those folks that have gotten us through this incredible pandemic. Now there's light at the end of the tunnel, but they have not let up, not one bit. Tonight's guest, and I think it's so timely and just an incredible accomplished man, Earl Dotter, who is a professional photographer. Now, Mr. Dotter, from what I understand and reading up about him, was inspired in 1968 when he met coal miners in Tennessee. And since then, he's been photographing and documenting America's workers. As a matter of fact, he's so respected that many consider him to be the American Workers' Poet Laureate. And we have him. We have him here tonight, and we're so incredibly proud. Mr. Dotter's photos offer a glimpse into truly how essential these workers have been during the course of the pandemic. And we're so excited to have him. So I'm going to stop talking because nobody wants to hear from me anymore. But Carrie, thank you for allowing me to say a few words. Earl, welcome. So happy to have you. And Fort Lee Library, thank you again for sponsoring this event.
Thank you, Mayor Sokolich. Earl, I'll turn it over to you tonight.
Okay, I'm going to share my screen and see if we can locate the presentation. It should be right here. There we go. That's working great. And we're going to start with the slideshow from the beginning. Let's see, here we go. Okay, we are there. If you are seeing a thumbnail of me intruding into the visual, I just minimized it so that we are just focusing on the presentation and not my face. Thank you, Mayor, for that kind introduction. It's a pleasure to be here with folks at the Fort Lee Public Library. I am delighted with the opportunity that Curry Weinstein and Jessica Schneider have provided me here. And I also want to give a shout out to the essential workers who have played such an important role in keeping us safe. And so let's begin. And I'm going to cycle to my first slide. By way of introduction, this is my wife, Deborah Stern, who's been keeping me safe during the pandemic. And Deborah and I have worked for the time we've been married for 35 years now, trying to keep coal miners safe and other essential workers more recently for me as a photojournalist. So just before Thanksgiving, Deborah cut my hair and my daughter took this shot of us. Neither of us had been vaccinated by that time, of course. And so we have been working together as a team, my wife and I, to keep coal miners safe. It has traditionally been the most dangerous job in America. Fortunately, it's no longer that. And there's reasons. that's the case. Picture I took in 1976 of a coal miner. He's a roof bolder, one of the most dangerous jobs in the mine. He has no roof support structure above him. But if you look at the picture on the right, this roof bolder has a hydraulically operated roof support system above him as he does his work. It's just an example of the kinds of improvements that have occurred. But sadly, there's a new pandemic in the coal fields, and that's the impact of large mining machinery being introduced into the thin seams of coal that still are mineable in Appalachia. They're cutting the rock above, the silica rock, and the coal. And that's creating a new pandemic for younger miners today. That's a new challenge. So we're looking at this issue from the standpoint of essential workers have always had challenges. Like they introduced the canary cage as one of the first personal pieces of protective equipment. That canary cage, if the canary started to falter, they knew that carbon monoxide levels were getting to an unsafe level. And the lamp at the right was a flame safety lamp that if the flame started to flare up, they knew that methane gas was reaching an explosive level in the mine and they better get out of that mine quickly. And so back to COVID, here's my wife. She's shopping for me. I'm an older guy, and I stayed in the car while Deborah went out and purchased our groceries. But on the way home, we encountered this free COVID-19 testing site, a walk-up clinic outdoors. And the lady who was in charge of the site said, the essential workers, you see one with a face shield on the right, were happy for me to take photos of them and recognize them for their work, but to be careful to try to keep the identities of those being tested less obvious. So we have had an opportunity here to follow essential workers and the personal protective equipment, the outdoor site provided a well-needed community service in this Washington, D.C. neighborhood. And healthcare workers and first responders were denied the benefits of the Emergency Paid Sick Leave Act, which provided 2 weeks of paid time off for quarantine and expanded family medical leave. The act provided 10 weeks paid time off to care for kids if schools or childcare facilities were closed because of COVID. This paid leave expired on December 31st, 2020. This act should be extended with all healthcare workers made eligible. Back in my Silver Spring neighborhood, that's in Maryland, my trash and recycling pickup crews were masked up. The one trash hauler was wearing a less than adequate mask to protect him during COVID-19. I also learned from these guys that for the first time, they enjoy health insurance as employees of Montgomery County and members of the laborers union. My local firefighters were at the ready and well protected when a resident's car caught on fire a few doors down from my home. And then Jose Cazajal, a second generation Aztec immigrant from Mexico, came down my block all masked up and gloved up, delivering my mail. I abided by the guidelines presented by my local car wash on Georgia Avenue. And so are the employees there, all working in a coordinated symphony, doing their designated jobs, all masked up. They're protecting each other. they're also protecting me, a consumer at that site. These Whole Food Amazon contract deliverymen deliver to us, keeping us safe within our own homes while they shop at the store and deliver groceries to our doorstep. At my early voting location in downtown Silver Spring, county employees were on the job, keeping the polling place tidy and accessible as residents voted safely at a distance inside or with drop boxes outside the polling place. Both those who staffed the polling places and registered voters who cast their votes kept everyone safe by following the CDC guidelines. Construction workers are essential workers who have long had an appreciation for the value of personal protective equipment. Hand signals to the off camera crane operator are a language all their own, critical to communicate and safely maneuver this large load of wet cement as it is lifted to the site of Washington, D.C.'s new Purple Line downtown in Silver Spring near where I live. The workers are masked up and their gloves also protect them from contact dermatitis by direct exposure, by avoiding direct exposure to the concrete. The crane operator needs those hand signals to move the construction crane safely. And notice the construction worker's flip-down mask shield and the fall protection harness he is carrying to his next job in the right-hand photo. Falls have been a serious concern for construction workers. And to address that hazard, see this Purple Line Ironworkers retractable fall protection lanyard and harness. It is tied off from a temporary post installed above the worker's position on the leading edge of the girder. The tie-off point is purposely located well above the ironworker. Compare that previous image with this ironworker tied off from below. Even though he is being spotted by another worker, it's easy to see the benefit of a higher tie-off point that is provided in the event of a fall. Cutting cinder blocks can expose this construction worker to hazardous silica dust, but not if the saw is fitted with water sprays and the worker is wearing a face shield. Notice the laborer wearing ear protection, and his hat sticker is promoting the building of a safety culture at construction company sites where he is employed. Today, construction worker hazard communication must be made in the multiple languages of the workers at the site. Here it is posted in Spanish, Polish, and English at an asbestos tear-out warehouse site, soon to become an NBC News studio in Midtown Manhattan. The protected asbestos tear-out workers are using the grab and bag tear-out method to safely remove the asbestos insulation. This pipe cutting operation provides a graphically arresting image made even more pleasing by the woman's use of all the required PPE to protect her. While taking a walk in my neighborhood in Silver Spring, Maryland, I noticed a Pepco power line crew worksite properly cordoned off from street traffic. I asked the crew's supervisor if I could come back and take photos, and he said, "That's fine, but I cannot talk with you. I have to keep my eyes on my crew because this job is so unforgiving." Over a couple of days, I became acquainted with Michael Dustin, shown here with gloves and shoulder-length insulating sleeves. Michael is installing insulation sleeves in all the electric lines in preparation of relocating those lines to a new upgraded power pole. As a thank you to Michael, I sent a set of these photos to him to share with his crew. He wrote back to me with these lines excerpted here. "If you make a mistake, most jobs forgive. Mine doesn't. Rubber boots, rubber gloves, rubber sleeves, On some days, I hate putting on and taking off this protective gear, save for the fact that this day could be my last. As the COVID pandemic was beginning last spring, my HVAC company called to safely arrange an appointment for a tech to service our air conditioner. On the phone call, they first made sure no one was in the house that was sick, and that my wife and I would wear masks too and keep our distance when their tech was inside our home. I first met Vladimir Ranza, the tech, on the street and asked if I could take pictures of him from outside while he did his work. Here he is before entering and as he was leaving my home. I did not follow him inside with my camera, but I was impressed with his outside work and by the steps his company and that Vladimir took to work safely during the pandemic. Vladimir appreciated the photos I sent him, and I have found that most essential workers, have never been given pictures of the work they do. As global warming increases, heat stress on road construction workers is a greater issue. Only California, Washington State, and Minnesota have already enacted heat stress standards. In Maryland, such heat stress worksite standards initiative is now seeking support from the state legislature. Those of you who are residents of New Jersey can also support such a standard. Highway flaggers are at risk of being hit by inattentive or irate motorists. On this high-speed roadway, traffic cones offer little protection to the flagger and the construction crew working behind her. But on these same kinds of road construction sites, intrusions are effectively controlled with concrete or water-filled barriers like those shown here in New York City. And looking back now 50 years to the 1970s, I took this photo of a cotton gin worker. He had to improvise his own PPE to protect himself. He used cotton balls stuffed in his ears for hearing protection and a bandana over his nose and mouth to protect him as best he could from the cotton dust. And going back all the way to 1908 here, Lewis Hine made this portrait of cotton mill workers in Indianapolis. Notice the cotton dust all over the young boys on the left. And going back even further, in 1859, the tintype was invented. It was the first time workers could afford miniature photo portraits of themselves. Note the girl, a housemaid on the left, and cotton mill loom tenders on the right with loom shuttles in their hands. These worker images from my collection show a hatter in the center who was exposed to mercury poisoning. Mercury smoothed out the fur pelts, a practice that continued well into the 1940s. Workers flocked to photo studios between 1860 and 1900 in their work clothes and with the tools of their trades. And tintypes document the extent of child labor in the industrial age. Here, a coal mine trapper boy with boys with lunch pails sit astride the mules they used to transport loaded coal wagons out of the mine. And on the right, you see a breaker boy with his coal-blackened shirt, whose job it was to sort slate from the coal before it was shipped. You see coal miners posed in their mining garb with lit open flame whale oil lamps right in the photographer's studio. And also notice the pair of plasterers standing tall. But before penicillin was invented, if you had a crushing workplace injury, you might face a slow death before infection took your life. Enterprising tintype photographers advertised photos on invalids taken on short notice. Tintypes made before the Grim Reaper arrived to become known as pre-mortem images. The young man standing next to a mourning chair commemorates a lost loved one. By the close of the 19th century, stereo view photographs had become the Victorian era's TV. Here you see some of the sandhogs who built the 2 Hudson River tunnels near Fort Lee. They were in danger of contracting the bends if they left their pressurized work site too quickly. And the badge that the worker wore attests to that hazard. Child labor continued in US mills and mines into the 20th century. The barefooted children's small hands were considered essential to insert into the mill's machinery. And the boys photographed at the end of their coal mine shift had to be at least 12 years old to legally work in Pennsylvania's anthracite mines then. In 1978, the tractor driver hauling this cotton wagon wears industrial eye protection and a mask, while the young black man in the cotton wagon had the benefit of neither. That same year, I photographed in the dustiest location in this South Carolina cotton mill. That location was called the Cotton Bale Opening Room. Sad to say, but I think it was purposeful that everyone in that dusty workplace was African American. To the north, in a Detroit auto wheel making plant, we see a production line worker showered with sparks coming from an electric wheel welder. The process required eye and protection and earmuffs to reduce the noise to an acceptable level. To be safe myself, I had to photograph this animal pathologist from far down the county health clinic's hallway, as the pathologist determined that yes, this was in fact a rabid raccoon. At about the same time, I was privileged to be invited by an industrial hygienist to photograph at the oil refinery where he worked south of Los Angeles. This worker is about to open a pressurized vat of chemicals. As he opened the vat, he was instantly engulfed in steam laden with chemical vapors. This unprotected exposure took me by surprise, but fortunately I was still able to press the shutter button to document it. After that experience, I did seek out appropriate opportunities to photograph training for safely handling hazardous chemicals, along with their disposal. This woman wears a color-coded respirator appropriate for filtering asbestos and other toxic dusts that were still emanating from the fires at Ground Zero after 9/11 in New York City. I secured access to the restricted Ground Zero site with an assignment to follow industrial hygienist Aaron Ondu, who was a member of the Operating Engineers Union Health and Safety Department. He was setting air quality monitor pumps inside and outside the cabs of the heavy equipment operators working on the site, who were also operating engineers. Aaron proved the Ground Zero air quality assessments made by Christy Todd Whitman, the EPA director then, that those assessments that the air was safe were incorrect. And maybe it's because the air quality pumps they set were practically off site at the edge of the perimeter fence on Ground Zero. I was on the site for a half a day, and so I was also free to photograph scenes like this one of iron workers being man-basketed into the remains of the destroyed Hyatt Hotel. It's a credit to those same emergency responders that no rescue recovery worker died while on the job at that site after the attack on the Twin Towers. Here you see firefighters looking for human remains as this grappler machine operated by an operating engineer opens up the pile. Personal protective equipment use had already been cultivated by the construction trade responders working at the site. That served them well during 9/11's aftermath. However, With the hindsight that almost 20 years later provides, the air quality hazards at the site are now claiming the lives of an alarming number of 9/11 emergency responders who were exposed to that tainted air when they were working on ground zero. The application of pesticides to orchards and farm crops is a constant concern to essential farm workers picking the farm foods we consume. Covering up, even in warm temperatures, is one way farm workers try to minimize pesticide exposures. And farm worker women have also found that face covering discourages sexual harassment in farm fields. A few years back, I worked with Amy Liebman, the Health and Safety Director of the Migrant Clinicians Network, to document the work of new immigrants on Maryland's Eastern Shore. According to the Food and Environment Reporting Network, more than 49,000 meatpacking workers and over 13,000 food processing workers have tested positive for COVID-19. And 254 meatpacking workers, 46 food processing workers, and 39 farm workers have died from COVID-19 as of November 30th last year, while providing food for us to consume. On a previous assignment, I photographed this Kentucky poultry farmer using respiratory protection while working in one of her chicken houses. Continuing on to the coast of Delaware, I found most folks wearing masks and keeping distanced on the boardwalk. All masked up, the Bethany Beach police officers did need to remind some beachgoers of the rules for COVID-19 on the boardwalk. Here, the boardwalk patrons and servers wore the required masks. However, with an ice cream cone in hand, this young boy pulled down his mask before leaving the location of service. Restaurant food services moved out to outdoor locations along the boardwalk. And back near my home in Maryland, streeteries have been set up for safer outdoor dining in the pandemic. A masked up Gabriella Foucon, a server at the Silver Diner, took our food order from a distance. However, my wife brought up her mask when the server moved in closer to pour her tea. Then after our lunch had been served, with Deborah unmasked, she was unexpectedly asked a question by our server, showing that there's still risks even outdoors. My periodontist practice has been proactive in effectively ensuring all staff are safe and the patients are well protected too. Hair covering, masks with face shields, latex gloves, as well as patient use of antimicrobial mouth rinse, temperature checks, screening sick patients, and safety shields protect staff, and safety glasses protect the patient's eyes. The dental hygienist is using more traditional enamel scalers instead of the ultrasonic power equipment that produces suspended air droplets. And communication between all staff at the practice is occurring at a distance. All these steps are limiting worker-patient exposure to the virus at my periodontist's office. And it is, of course, hospital workers who are of prime concern today as COVID-19 resists vaccine protection with new variant virus mutations. According to the National Nurses United, more than 1,700 healthcare workers have died of COVID-19 since the pandemic began. I photographed these operating room nurses as they donned PPE at the end of last year in Buffalo, New York, well before the major COVID spikes that occurred later there. A surgeon with other operating room staff using PPE performed surgery on a mesothelioma victim at Mount Sinai Medical Center in Manhattan in 2019, again before COVID altered the healthcare landscape in New York City. We, the public, have a duty to keep ourselves from exposure to the COVID-19 virus. The toll of lives lost from the ranks of our healthcare providers should be a grim reminder. It is now our duty to keep them well distanced from all possible COVID exposures. Having been vaccinated recently, I was able to photograph the good work of Dr. Judith McKenzie and her able assistant, Jamie Curran. Dr. McKenzie, in the white lab coat, oversees the UPenn COVID-19 staff vaccination program for the entire hospital in Philadelphia. Here you see UPenn staffer being directed by Officer Anthony McDare. He is directing a hospital employee to the vaccination waiting area for her first vaccination shot. Another staffer is directed by Officer McNair to the waiting area for those UPenn employees receiving their second vaccination. RN Joy Park directs patients from the waiting area to specific pods where they will receive their vaccination. Dr. McKenzie signals for her next patient to come to pod 5 to be vaccinated. UPenn staffer Jeffrey Devon is ready for his second vaccination, administered by Dr. McKenzie. The beginning of relief from COVID-19 worries arrives with Mr. Devon's second vaccination shot. The used syringe is appropriately disposed of, with the last step, a Band-Aid applied to the site of the needle stick. Clinical pharmacist Emily Inverso draws the COVID fighter vaccine into syringes. Michelle Vitale tends to a staffer experiencing a reaction to her second shot. Nurse Vitale and Dr. McKenzie confer about the staffer's health status. And UPenn staffer Abdi Hassan presents his ID before his second shot, administered by registered nurse Alicia Johnson. Here I present an image of hospital laundry workers I took in Brooklyn back in 1998. The laundry workers had presented to my camera all the sharps that had tumbled out of the bed linens they were preparing to launder over the course of a year. And that was when AIDS and hepatitis C infections were still raging. To me, this image is a visual presentation of what COVID would look like if it could be photographed. Fortunately, these workers wore wire mesh gloves to protect themselves. So let's all praise essential workers who are putting themselves in harm's way to protect us. We can offer that praise and respect by doing our part during COVID to keep ourselves masked up and distanced, bringing the pandemic to a halt sooner rather than later. I thank you for your attention to this request out of respect for what essential workers are doing for us in the time of COVID-19. After all, when masked up, we not only protect ourselves, but also the health of the community in which we reside. Many essential workers have a similar opportunity, essential workers have a similar opportunity to enjoy the fruits of their labor as we have, if only because of what they are doing for us. I thank you. That's the end of my presentation, Carrie.
Thank you, Earl. Can you see the Q&A box?
I am going to stop sharing now, and I think I will be able to do that. Okay. And now, let's see. I'm going to end the slideshow and click to exit. I'm going to close that down. Let's see. Now, I am still trying to get back to the screen here. It says I'm still screen sharing. So I'm going to stop the share. There we go.
You're back.
Okay. Sorry, took a while. All right, I see the chat box.
Okay, there was a question in the chat.
Okay.
There was one question was about where was the photo, what hospital was the photo with the needles taken?
That was taken at a laundry in Brooklyn that serviced 5 different hospitals in the borough of Brooklyn.
And another question, did you see anyone wearing a real respirator, especially those indoors for any length of time or near others a lot?
Because up until 2 weeks ago, when I received my last COVID shot, I got the Pfizer shot. I was not able to get close in a indoor location with the possibility that the virus was present. So over the course of my work pre-COVID, I've certainly seen the use of full respirator protection in use.
There was also just a comment, just to thank you for the photographic inspiration for myself and many in my family.
Very good.
And
Well, I can add to that. It's really an opportunity for all of us now that you really have an opportunity with your cell phone cameras to do useful work photographing the pandemic. This is a historic circumstance that hopefully will not occur again in our lifetime. And we think back to the pictures taken in the 1918 pandemic. Fortunately, we have that record, but from a personal perspective, I think it's important that we document our own experience, our families, the folks in our neighborhoods and communities to keep up. This is an important record to record.
I see 2 more questions, Earl.
Sure.
Of all the many groups that you have photographed, what group has interested you the most?
Well, it varies, of course. I am privileged to do what I do. Let me first say, I've enjoyed every day I go to work with my camera. I used to be a shy kid, and the camera has given me the nicest excuse to poke my nose into other people's business. I was trained by a photography instructor who only allowed us to use a 50mm lens. That's a lens that shows you just what your eyes see. And that lesson has stuck by me because I had to engage with my subjects. And as you can see in the commentary with Michael Dustin, the lineman, the HVAC guy, Vladimir Ranza, my trash haulers, they are all people I know in a personal way. And that's important to me as a photographer to bridge that gap between me, the photographer, and them as the subject. In many senses, if the subject understands who you are and why you want to take the subject's photograph, they have a great understanding about that. And as Michael Dustin did, he wrote a poem about his work that expressed the unforgiving nature of it. And so each of my subjects has a special real human quality to it that I try to capture that is common to all of us and our humanity. And I hope those pictures come through. With the mask on, it's a little harder job to do because the full visual cues of our social interactions is not completely available to us. So I hesitate to say which images are more special than others. I will say, as work has become more automated, more routinized, that the physical work that I photographed earlier in my career 50 years ago, starting with the miners, that has a quality about it that shows the physical nature of the work in a way that is more photographic than someone pressing a laptop keyboard. So that's kind of an extended answer. I kind of avoided answering it directly, but I hope some of those other insights were useful.
Thank you. There are two more questions if you have time.
Sure.
As a photographer, have you seen a difference in the protections workers have if they have a union compared to those who don't?
I have indeed. And it's really a tribute to the fact that no worker died in the aftermath of the rescue recovery effort on Ground Zero at 9/11. That was a major accomplishment. That work site was extremely hazardous. And so that was a tribute to the safety culture that the construction trade unions had inculcated in their workers. I see that in so many other instances, in the way firefighters do their jobs, the way folks on production lines and the auto plants, and to an extent, we're seeing an awareness of how important health and safety services are when the digital workforce, the gig economy workforce, taxi drivers who don't have any backup for the dangers they face on their job, delivery workers. It's a whole new arena that can be addressed with an appropriate health and safety department within a trade union appropriate to that kind of work.
Okay. Oh, the next question is a two-parter. Could you say something about your ability to get access to these sites? And
Yes, it's not easy. You have to be a little bit ingenious. More recently, as I've become an elder in my community, just walking around the neighborhood, meeting my postman, meeting the folks rebuilding our power lines down the street from me, becomes a whole area of access. And it's largely the health and safety department at the United Mine Workers Union, who was concerned about black lung disease and high injury rates, that opened the plant gate to me at coal mines. And I have to say, though, folks who have not had the benefit of a union, like commercial fishermen in New England, have opened the doors to me because they know they have the most dangerous job in the United States. It's a tragedy that repeats itself regularly in New England, where I photographed commercial fishermen for a year, over the course of a year, 20 years ago. It's not gotten much better. Um, and, and so there is a safety consciousness among workers because of their direct experience. That does open the door to me. I was invited to spend 10 days on a 80-foot steel stern trawler in December out of Portland, Maine, to go into the North Atlantic 120 miles out. And we only came back early because storms prevented the fishing from being successful. It was a hazardous experience. And the captain's advice to me was, Earl, don't turn your back on the water. Because one night a rogue wave came, you could hear it before you could see it in the darkness. And it almost fully engulfed the boat, really almost to the point of foundering it. The entire back of the boat with the fish that had just been hauled on board was low in the water. And the three fishermen working in that part of the boat immediately dived in and opened the scuppers to let the excess water out. And all their fish went out too. But they were fearing a second wave that would have sunk their boat. So that's just an example of a safety consciousness that the work experience builds within the workers. And it enables them to think of inventive ways that they can address the safety issues if, for instance, they get hauled overboard by a lobster trap rope. Normally the boat would be idling forward, and the fishermen in the water would be overrun by that boat ultimately. But they've installed these kill switches, cables that run along the port and starboard and stern end of the boat that a fisherman could pull as they get pulled off when a trap rope gets caught in their boot. So there's plenty of ways to show, and that's what I like to do, the inventive steps that workers of all descriptions take to make their work experience a long one and a healthy one. And that's what really appeals to me, because there is an intelligence and a commitment to improving their lives, and we all benefit from it. And certainly the fishing community benefits when their family remains intact.
Okay. The second part of that question was, did you do your own darkroom work back in the day? Back in the day is in quotes.
I did, and it was a good lesson. I still have all that equipment up in my attic space. I couldn't let go of it. It's a more contemplative approach because it takes a long time to make a picture all that it can be in the darkroom. You'd be in the middle of creating an image and the phone would ring, or you get interrupted for another reason and you forget where you are and you had to start all over again. And each time you had to perform the same steps the same way to create multiple prints, which you needed back in the film era, because one or two copies would not be enough when you had requests for those images. So that was a different process. And now, over 50 years later, I am going back to those same film negatives and scanning them. The film era, it was hard to control contrast. But in the digital era, you have a much better handle on keeping detail in the highlights. And those same pictures scanned versus printed in a wet darkroom are somewhat different. And I have to say, I do like what I'm doing now as I return to my files, and I'm finding pictures that I could never print in the darkroom that now I can print as scans successfully. So one way enhances the other. I will just add by saying that I love shooting digitally because it used to be you had the constraints of burning up too much film that your client was paying for, and that film had to be processed, it had to be proofed, and then it had to be printed. Very, very few photos today actually go to print. They remain as digital files and are printed in the print shop. From those digital files, we store our pictures as digital images these days. We no longer have the large scrapbooks, but thankfully, Deborah, she makes a photo calendar every year from highlights of the previous year. And when we make a special trip, we actually make a book out of that. And so those digital images can go to print, but they're made as a final product and not as individual prints usually. Did that answer some of that question?
I think so. I have some more questions, but
Sure.
the Ground Zero workers may not have died, but many have serious occupational illnesses years after, correct?
Yes,
Could those diseases have been minimized?
I do believe so. I think that a recognition of the air quality hazards early on would have had a good effect on the outcomes that are being revealed now. It's a sad story. Actually, the success initially was amazing. But the sad story later is we hear of workers. You have a friend, Carrie, who recently had a lung transplant, and so the families are suffering probably shorter lives that in their latter stages are quite unhealthy because a lot of the maladies are lung related. That's my understanding of it. And so I kind of forget what the actual question was, but
Could those diseases have been minimized?
yeah, I think that I don't know if there was a widespread understanding that Tower 1 and Tower 2 had asbestos in them at the time the buildings came down, but Tower 1 had, I think it was the first 20 or 40 floors was completely full of asbestos in the building materials. Then an enterprising investigative reporter wrote about asbestos flying around all of Lower Manhattan as the towers got higher, and that material was blowing all around. They couldn't control it. And the New York City Public Health Department shut the worksite down till an alternative could be found. However, it's been investigated, and all that extra asbestos ended up in elevator shafts in Tower 1 and Tower 2. And you may know that asbestos disease takes a long time to manifest itself, sometimes 20 or 30 years. And we're beginning that window now. I think if there had been a real concerted effort in that early in that emergency to really look hard at the level of protections that were needed, particularly with the air quality, it would have made a difference.
Thank you. And I want to share one comment. Thanks for sharing the names of workers in your photos. I thought that was a great touch too. Put a name to each face that we see in each worker. And we'll take one last question as we're getting near 8 o'clock. Do you think that the fact that the general public has had to protect themselves with COVID-19 PPE will mean that laborers will have more appreciation for work-related PPE in the future? Will it be easier to instill a safety culture?
I think in this tragic circumstance, that might well be a yes. We, the general public, have had to avail ourselves of personal protective equipment every day. And there, unfortunately, masking up has been politicized, and that's an unfortunate circumstance because it's not a political issue. It's a public health issue. And if my presentation can present a message, it's that we've essential workers through our history have had to adopt personal protective equipment at early stages of our history to survive. And the searing toll of lives lost from our public as well as within the essential worker community and our healthcare providers, the frontline healthcare workers, that toll is a lot of it is probably unnecessary because of the situation where if we had masked up appropriately, the spread would have been reduced sooner. So it's a bit of second guessing, but I think there's an important message there for all of us to be well aware of the importance of public health measures that will protect you, protect me, protect our families, and protect our community.
I think that was a great answer and a great way to wrap up this program tonight. Earl, thank you so much for sharing your presentation and your experiences. Thank you to Mayor Mark Sokolich for offering introductory remarks, and thank you to everybody who's attended tonight.
I'm so glad to have had this opportunity. Thank you.
Good night, everybody.